Welcome to Group 42's Clinical Correlation Project over the liver. This presentation is by Presley Morris, Rachel Snyder, Reagan Helscher, and Rebecca Borchers. We hope you enjoy.
Introduction to the liver. So the main functions of the liver are to produce bile, which helps in the digestion of fats. And the liver also filters the blood of drugs, ammonia, bacteria, and other toxic substances and sends them to the excretory system. So in the bottom here, you can see a picture of the liver. And then to the right, here are two different microscopic slides of what a normal liver should look like.
The first liver-related disease that we will be covering in this presentation is non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease is described as fat buildup in the liver, not caused by alcohol. For fatty liver disease to be considered non-alcoholic, a person must consume less than 2 to 4 drinks per day. This is the most chronic liver disease in the U.S. and affects about 25% of the world's population. When left untreated, extreme cases can cause permanent scarring called psoriasis. This can also lead to fibrosis due to chronic inflammation. The main causes include a person being overweight and carrying most of the weight in his or her abdomen, having an insulin resistance, having hyperglycemia, or having high levels of triglycerides. While the reason why some people produce more fat on their liver than others is not known, there are many traits that can increase a person's risk. The at-risk population contains those with prediabetes or diabetes type 2, if the person is middle-aged or older, if the person is Hispanic, if the person has high blood pressure, metabolic disorders, has experienced rapid and unexplained weight loss, if the person has hepatitis C, sleep apnea, hypothyroidism, or hypopituitarism. There are not many specific signs or symptoms of non-alcoholic fatty liver disease. A patient may have fatigue or discomfort in the upper right abdomen where the liver lies. In extreme cases of psoriasis, there may be abdominal swelling called ascites, enlarged blood vessels just beneath the skin surface, an enlarged spleen, red palms, or jaundice.
Non-alcoholic fatty liver disease generally presents no symptoms in patients. Usually the first indication that a patient may have non-alcoholic fatty liver disease is abnormalities which show up during testing for other diseases. To confirm a patient has non-alcoholic fatty liver disease, a doctor may use blood tests, imaging, or in rare cases, a liver biopsy. As of now, there currently are no FDA-approved drugs for non-alcoholic fatty liver disease. NAFLD is associated with being overweight, having diabetes, having high blood sugar, and cholesterol problems. Because of this, treatment usually involves starting or maintaining a healthy lifestyle. Depending on the patient, this can include losing weight, exercising more, and eating healthier foods. If the patient has diabetes or cholesterol problems, part of treatment for NAFLD is to control these. It is also recommended to take steps to avoid adding any undue stress onto the liver, such as drinking, alcohol. In extreme cases, such as when NAFLD has advanced to non-alcoholic steatohepatitis, a liver transplant may be needed. On the left is a normal liver without non-alcoholic fatty liver disease. On the right are two cases of non-alcoholic fatty liver disease. The first picture on the right depicts typical NAFLD. There are significantly more fat cells present in the tissue than there are in the normal liver tissue. In the second picture is an advanced form of non-alcoholic fatty liver disease called non-alcoholic steatohepatitis. There are still more fat cells present, but the liver has also started to become scarred, fibrous, and stiff.
The other liver-related illness that we will be covering today is called Wilson's disease. Wilson's disease is a genetic disorder in which copper builds up in the bloodstream. The copper is not properly removed by the liver, and it will tend to concentrate there as well as in the brain and eyes. Sometimes a Kayser-Fleischer ring will form, and this is a greenish-brown ring around the eyes due to copper deposits. Symptoms for this disease typically present between ages 6 and 45.
Wilson's disease is an autosomal recessive disorder, meaning it's genetic or passed down from parents to children. The disease harms a gene called ATP7B. It makes this gene defective. Usually, this gene would be used to encode an enzyme that transports copper out of the liver. But since this enzyme isn't working, the copper will build up in the liver and move around the rest of the body. It's really toxic, and it can also harm our secondary organs. In the top right, you can see that the green staining is copper in the liver. And in the bottom right, you can see some of the really pale areas. That's the necrosis that's happening in the liver. Hepatic symptoms of Wilson's disease are the most common type of symptoms a person experiences. They usually occur between the ages of 6 and 45, but you may be asymptomatic up into your 20s or 30s. Usually there is an abnormality in blood work that correlates with hepatic steatosis, or fat buildup in the liver, and inflammation. The inflammation, if it goes without treatment for a long period of time, causes fibrosis and scarring of the liver. There's also high levels of copper that can be detected in urine and blood through testing, and acute liver failure is eventually the ultimate symptom of Wilson's disease, and necrosis of the liver as well. More recently, hepatocellular carcinoma, a type of liver cancer, is being reported as a symptom. The next most common symptom a person with Wilson's disease may experience is neurological symptoms. Usually these are speech problems, clumsiness, a tremor, drooling, trouble walking, stone-like facial expressions, or deterioration of the handwriting. None of these are really cognitive. They don't affect a person's ability to be coherent or understand things. It's more like Parkinson's disease, where it's physical. People may go years before getting a diagnosis with Wilson's disease because these symptoms really mirror Parkinson's disease. An MRI is the telltale way to know that it is Wilson's disease and not Parkinson's, though, because Wilson's disease will show focal lesions on the brain, unlike Parkinson's. There are many other common symptoms. Some of these include osteochondritis, acidic urine, and sunflower cataracts.
Diagnosis for Wilson's disease is usually done through a blood or urine test. In these tests, typically they will look for the liver enzymes alanine transaminase, ALT, and aspartate transaminase. Typically, with Wilson's disease, the levels for these enzymes will be low. There will also typically be high levels of copper in the bloodstream or urine. And occasionally, anemia will be a side effect, so there will be a low red blood cell count. Occasionally, a biopsy may be done to confirm the diagnosis. The disease may also present itself as viral or autoimmune hepatitis, and without treatment, it will lead to fibrosis, scarring, and liver failure and cancer. If you look at the images to the right, the one on the bottom is a picture of a blood smear for someone who is positive for Wilson's disease. In the top picture, there is a typical H&E microscope image along with another different stain that is used to identify Wilson's disease. You can see little granules in these cells, and these are deposits of copper within the liver cells. Wilson's disease is typically treated through the use of chelating agents, or medicines that remove copper from the blood. Some of the most common ones are penicillamine and trientine. People with Wilson's disease may also be treated with zinc, which will prevent the intestines from absorbing copper present in the digestive system. Typically, they will also follow a diet that is low in copper and avoids foods that are high in copper, such as shellfish, seeds, nuts, whole grain products, and chocolate.
This question shows 3 pictures, 1 of a normal liver and 2 of a liver affected by non-alcoholic fatty liver disease. For answer choice A, fat cells present in the normal liver, these pictures are showing an abnormal amount of fat cells in the liver tissue, so this answer is not correct. For answer choice B, evidence of scarring in the liver, this picture shows a picture of a normal liver tissue, so this answer is not correct either. For answer choice C, steatosis, abnormal buildup of fat cells, this answer choice is correct because there are an abnormal amount of fat cells in these liver tissues.
Exam question 2. Which of the following does not put a person at risk for non-alcoholic fatty liver disease? A. Diabetes. B. High blood pressure. C. Hyperthyroidism. Or D. Hypothyroidism. The answer is C. Hyperthyroidism. Diabetes, high blood pressure, and hypothyroidism all contribute to non-alcoholic fatty liver disease, as we discussed at the beginning of the presentation.
The third exam question we have is, which of the following is a symptom of Wilson's disease that correctly corresponds to the treatment given? A is high levels of copper in the urine and a zinc supplement as treatment. B is speech and writing issues, and the treatment is low copper diet. And C is the inflammation and necrosis of the liver, and the treatment is amoxicillin. So the answer for this exam question is going to be A, because high levels of copper in the urine are commonly treated with a variety of medications, including a zinc supplement, but B and C do not correspond with their treatment. While speech and writing issues are a symptom, a low copper diet isn't used to treat that neurological problem. And inflammation and necrosis of the liver is treated with medication, but not amoxicillin. And of course, we want to give credit where credit is due and cite our sources. Thank you so much for listening to our presentation on the liver.